What is rehab or rehabilitation? My name is Fred Bigueras, a board-certified sports and spine medicine physician in Virginia Beach, Virginia. After 10 years of practice, I still find musculoskeletal medicine both fascinating and challenging. This podcast is about the lingering thoughts and questions I've had after residency and fellowship. My hope is to spark discussion, challenge dogma, and share my experiences in musculoskeletal medicine. Welcome to the Talking Rehab Podcast. I had an interesting discussion recently with a physician regarding rare diagnoses. This particular physician saw a patient that had a series of diagnoses made by other specialists, including Ehlers-Danlos Syndrome, Postural, Orthostatic Tachycardia Syndrome, and also Mast Cell Activation Syndrome. These are very difficult diagnoses, and essentially the physician I was talking with, didn't think that they had any of these diagnoses. And so as the conversation unfolded, it came down to, do you manage and diagnose these particular conditions? And essentially the answer was no. And the rationale was that these diagnoses are very rare. And that got me thinking about, are these type of diagnoses actually rare? I mean, I know they are difficult to diagnose just clinically and diagnostically. These are very difficult sometimes to gain objective information. But are these actually rare? At least in medical school, that is what we're taught. A lot of these zero diagnoses, they're rare. They look like a lot of different conditions, but they are relatively rare. This particular physician said, well, these are rare, and I don't think that these are appropriate diagnoses for this particular patient. And they also kind of extended and said, a lot of these diagnoses also carry a financial incentive. And, that's where I was like, well, you can come to your own conclusion, but do you necessarily have to disagree with these other physicians? Because presumably it comes down to, if you are a specialist that does not treat or see these diagnoses or even manage them for that matter, are you really qualified to disagree that that's what they have? I mean, certainly you can have an opinion, but is it really valid? And it was kind of an interesting discussion because rare diseases, in my opinion, are rare because they are difficult to prove, but more importantly, physicians carry the bias that they are rare. So if I carry this bias, how likely am I going to find these conditions in the clinic if I'm not looking for them? And that was the point of my part of the discussion. And physicians can sometimes, they can be a little bit defensive in terms of this line of questioning and rationale. And personally, I think this is a problem because patients obviously rely on our objectiveness and our ability to diagnose, but physicians are also very reliant on objective evidence. A lot of conditions we treat have no actual objective evidence in terms of imaging or lab work. So as an example, if someone has a history of anxiety, depression, or ADHD, the typical testing is, MRI, lab work, looking for all these other conditions. But on the whole, it's a clinical diagnosis. So when I have a patient that has, let's say, Ehlers-Danlos Syndrome, and a specialist concludes that, well, there's no diagnostic evidence of this condition, I have a hard time accepting that as the rationale, because we clearly accept other diagnoses without MRI findings, without lab findings. So I don't really buy that in terms of as a rationale to say that this person does not have this condition because it's not provable in a way that I'm comfortable with. And it's actually really a point of frustration for me because, in my opinion, I am finding people with some of these quote unquote rare diagnoses, but then to communicate that to another specialist is can be very difficult, because if I find something that is, what the other person believes to be rare, and I know that they need, a treatment from that other specialist, I have to convince that other specialist that they have this diagnosis. So if they have that bias already that it's rare, what is the likelihood that that specialist I'm talking to is going to believe me? So a lot of my efforts in my practice is really looking for like-minded individuals that are at least open to this diagnosis. Now, I don't want to say that some of these diagnoses, like Ehlers-Danlos, is like an epidemic, but um, how do we know? If we're not looking for it. And again, a lot of physicians really don't appreciate it. So it's like, how do we really know? I'm not saying it's like hypertension, but at the same time, I feel like I've seen it more often than not over the years, and might have recognized it right off the bat. I knew that something was wrong, but I couldn't put my finger on it. But looking back, these were probably patients on a spectrum of disease, where we just can't pick things up. I often use this analogy of, people can look and feel sick, and then you take their temperature, and their temperature's normal. It doesn't mean that they're not sick. It's just that they don't have a temperature. So I really want physicians to start to expand their view of disease and health, I guess, even for that matter. Um, it was, ultimately a very productive discussion. I don't think I convinced the other doc, that I don't think I changed their mind. At the end of the day, I don't think I changed their mind. I think we had a discussion, but I don't think I was effective in trying to change their mind. And that's not really, I think, what I'm trying to do either. I'm not trying to change people's minds. I, at least at the minimum, is I want them to be open to other ideas. I think that's where, as clinicians, we can grow, and it's also a place where patients can feel heard. Because, if I already come into the room and I see a diagnosis that I already believe is rare, but without even talking to the patient, I can almost guarantee you that my ideas for trying to come up with treatment options are going to be quite limited, because I already carry the belief that there is no cure, or that it's not real, and it doesn't help the patient. I honestly think that it is a big problem in the medical community, where we simply just don't believe certain things, and that's it. It doesn't make a difference even if there is research. If we just don't believe it, then that's the bottom line. And research into that field stops. Again, that's also another bias of research, is that research is done on conditions that people find interesting. And if clinicians are saying, like, these diagnoses are interesting but they're not real, or they're rare, then these studies never really get designed. So it's kind of a vicious cycle. So I wanted to end with, at least with this thought. Clinicians, if you are listening to this, please, please, please start to question, what diagnoses you think are rare, and ask yourself, are they actually rare? If you can at least start to move your mindset in that direction, I think that's a big first step, because I think coming out of medical school, the default is that it's rare. But then as we all grow in our practice, I think we find that book knowledge and real world knowledge, there's usually a gap. So I encourage you guys to keep looking. Don't just assume that everything we learned, 10 years ago, 15 years ago is dogma. So please keep your mind open, guys. Have a great day. Thank you for listening to the Talking Rehab Podcast. I hope that this podcast stimulates you to question your own practice and how you approach rehabilitation. I truly appreciate your time and attention. If you enjoyed listening, make sure to like and subscribe to the podcast. I wish you a movement-filled day. Take care.